Welcome to this online EMT program lesson. This is the second of two parts on the respiratory system. In part one, I discussed the pertinent anatomy and physiology. In this section, we'll cover ventilation and respiration in much more detail. Let's get started. First, a quick reminder of the basic function of our respiratory or pulmonary system. By the way, both terms are considered accurate. This body system is designed to do two relatively simple jobs. Bring oxygen into the body and bloodstream so that it can be delivered to all the cells, and remove carbon dioxide that is created during the cellular metabolic process. There are essentially two stages in these jobs. The first is ventilation. The term ventilation is used to describe the process by which we move air into and out of the body. It is accomplished by a neuromuscular interaction that allows us to change the pressures in our chest cavities. Now, there are three phases to the ventilatory cycle. The first is a resting stage, where the pressures inside the chest and outside the bodies is equal. When the pressures are equal, there's no air movement. Next, a stimulus will be sent from the nervous system to the intercostal muscles of the chest and the diaphragm, and the chest will expand in size. This drops the pressure inside, and air will rush in an effort to equalize those pressures. Now, sensors in the lungs send a signal to the brain when the lungs are adequately inflated and the nervous stimulus stops. The muscles relax, the chest falls back to its normal dimensions, this increases intrathoracic pressure, and air is forced out. Then we enter another resting phase. This cycle will continue millions of times over the course of our lives. Now, real quick, for this system to work ideally, we're going to need a few things. First, open airways so that air can get into the lungs. We need neuromuscular function. This allows us to change the pressures in the chest. Finally, we need a closed thoracic cavity. There can be no air leaks because this will defeat the system. If any of these are not present, we got a big problem. And you know what they say, when you can't breathe, nothing else really matters. All right, once we have air in the chest, phase 2 can start. Phase 2 is respiration. Now, some people use ventilation and respiration synonymously, but they're really two entirely different things. Ventilation is the movement of air into the lungs. Respiration describes the movement of the gases from one area of the body to another. Now, I know that may sound like splitting hairs, but they are significantly different. Let me show you what I mean by respiration. Once ventilation has filled the lungs with air, the component gases in the air will move due to something called diffusion. I'll describe that a little more about diffusion in a few minutes. But diffusion means that oxygen in the lungs will then move into the bloodstream. The cardiovascular system will pump that blood to all of the body's cells, where the oxygen will leave the bloodstream and enter the cells, where it can be used to power the cell's activities. Carbon dioxide is created by the cells during this process. It moves from the cells to the bloodstream, where it's transported to the lungs. Once arriving at the lungs, it can move out of the blood vessels, and the ventilatory process can then remove it from the body. So respiration is the gas movement from lungs to blood vessels to cells, and vice versa. All right, now let's talk a little more about diffusion. Diffusion is a physical law, kind of like gravity. But instead of describing that stuff falls down, it has to do with how particles move. Diffusion says particles will move from an area of high concentration to an area of low concentration. In other words, the particles are going to move until they are equally distributed. A kind of gross but very descriptive example is a fart. If someone releases gas in one part of the room, there's a high concentration of gas particles in that area. But very soon those particles will move until they're equally distributed over the entire area, and everybody is soon aware that somebody cut the cheese. But that's got nothing to do with respiration. Okay, let's talk about respiration. The air we inhale contains 21% oxygen. The blood returning to the lungs has a much lower oxygen concentration. So the oxygen will diffuse out of the alveoli into the blood vessel. Now that same blood is carrying a lot of carbon dioxide from the cells, but the air we inhaled has very low carbon dioxide levels. So carbon dioxide, due to diffusion, will move into the alveoli. Now we exhale to remove that CO2. Later, we'll inhale again, and this process will start all over. One last thing about diffusion. The greater the difference in concentration, the more gas will move. One of the things that EMTs do is give patients oxygen. In doing so, we increase the percent of oxygen in that inhaled air. Therefore, more oxygen will enter the bloodstream and ultimately be delivered to the body's cells. So if we suspect that the cells are sick and could use a little more oxygen, we can administer it. So now we know how we get the air in and out and how the gases move in the body. This is extremely important information to us in the medical field. You're going to spend quite a bit of time learning how to assess for breathing adequacy and how to manage problems that impact the pulmonary system. I'd like to briefly provide you with some of the signs that we may see if a patient's having trouble ventilating. First, we measure the rate. In other words, how many times a minute are they breathing? Is it too slow? Is it too fast? We also assess the pattern. By pattern I mean, is it regular or irregular? Irregular breathing often indicates problems. What about depth? If a patient is huffing and puffing, trying to move a lot of air, that generally indicates a problem. You're going to learn about accessory muscle use later in the class. When we're really struggling to breathe, we use additional muscles in our attempts to move more air. Nasal flaring is a common sign of ventilation issues in kids. Seesaw breathing is also seen in children. It describes the alternating rise and fall of the chest and abdomen. If the patient's head is bobbing up and down, they may be having trouble moving air. It's also a sign that they may soon lose consciousness. Funny noises, things like wheezing or rattles or any other noise when breathing, is typically a bad sign. Finally, a lot of folks who are having trouble breathing will get in what's known as the tripod position. This is where they're leaning forward with their hands on their knees. Most people with breathing problems will refuse to lay down. Well, that's it for this lesson, guys. We've gone into some really critical information that all EMTs must understand. Learning to assess breathing adequacy is mandatory for all healthcare providers. And you're going to hear a lot more about this stuff as you go through the class. Good luck, and I'll talk to you again in one of the other lessons.